observed a lot of energy in the organization that's really been generated by the Magnet program. And there are a lot of examples of nursing quality initiatives. One that comes to mind is an initiative at Emory University Hospital where the nurses got together and based on their understanding of some information in the literature, started a program to reduce central line associated bloodstream infections.
Hi, I'm Mary Zellinger. I'm the clinical specialist for cardiovascular critical care at Emory University Hospital. And in 2007, Carolyn Hold and I identified problems independently with bloodstream infections in our ICUs here at Emory. And we had attended the Quality Academy at Emory Healthcare and decided to work collaboratively together to roll out a process where we hoped by using chlorhexidine wipes we would be able to improve the rate of the BSIs in our ICUs. So in January 2008, we started a program to work with the staff nurses in all of our units to roll out our process for making changes in our current practice.
I'm Carolyn Hold. I'm a clinical nurse specialist in the medical ICUs at Emory University Hospital. And as Mary said, we worked collaboratively with this process to try to improve outcomes with our patients in the ICUs by using daily baths with chlorhexidine. And we had reviewed the literature as we did the planning process for this project, and some of the studies showed that not only could we reduce central line associated bloodstream infections, but also resistant organism infections such as MRSA and VRE. And so that was those were two of our aims in this project with implementing the daily bath with chlorhexidine. And the outcomes of the project are that basically we reduced our MRSA and VRE new colonizations to 0 during our study period. We looked at our infection rates 6 months prior to the study and implementation of the daily baths, and then 6 months afterwards. And then we also reduced our bloodstream infection rates significantly. We only have had 2 infections since we implemented the daily chlorhexidine baths in our ICU.
Hi, my name is Caroline Durkee, and I am a staff nurse in the cardiovascular ICU at Emory University Hospital. I've helped out with the CHG project by doing monthly audits, data collection, and helping improve and encourage compliance amongst the staff. We've done this by having huddles with the staff in our meetings and also our unit practice council meetings. We've also had to look at educating the patient care assistants along the way because they help out so much with the baths. We had to make sure that they were knowledgeable about the correct way to use the baths, and also just make sure the staff and both the patient care assistants were knew about which products on our unit were compatible with the CHG baths.
I'm Amy Hannick. I work in the MICU here at Emory University Hospital, and I was also involved in the chlorhexidine bath project. And some of the issues we had for the project was patient and family education, and to address that, we made signs to post in each patient's room, and we explained to patients and families that we were doing the chlorhexidine baths instead of soap and water for their safety and because it was more effective. We also had compatibility issues with many of our skincare products that nurses and techs noticed. So all of the items on our carts have now been changed over to items that are compatible with the CHG baths. So that has been addressed. And then the big issue too was just making sure that all of the staff was on board and on the same page with the CHG baths. So they're done daily for each patient, and we had to make sure that they were being charted so all of the staff would know who had had the baths done. So the RN and the PCAs or the techs give the baths, and then they're sure to document an MTech when they were given, so we know that they're done every 24 hours.
Magnet means me.
Magnet means me.
Magnet means me.
Magnet means me.
Magnet means me.